Most women with a breech baby towards the end of pregnancy will give birth by caesarean section. The aim of the BABE course is to provide participants with the knowledge and skills in supporting a woman with a breech presentation, in particular, skills in managing a vaginal breech birth.
A course like this aims to address this deficiency by concentrating in detail on how the baby does the breech birth in a normal situation and all the various little things that can go wrong and which are quite easily correctable with the right knowledge and presence.
There was a clear interest and need to develop a course that enabled clinicians to safely practice vaginal breech birth.
I think it's important to have consumer presence at BABE because being here reminds the clinicians that vaginal breech birth should be an option for women.
The course was just fabulous. I think great things can be achieved when we work respectfully in a multidisciplinary team. We work in partnership with a woman.
The people that come to this course, the participants, are already becoming experts in their field, and this increases their level of expertise, becoming a breech expert.
I attended the course because I have previously been involved in breech birth a long time ago, but not so much more recently. And I was interested to see what everyone else was doing around Australia.
It's very important for experienced and less experienced clinicians to be ready for this situation so that it can be managed in the current most efficient way possible.
I picked up lots of tips and manoeuvres when things aren't going well and to get us out of tricky situations with breech birth.
And this is an opportunity to work with women to optimise their choices for managing labour and birth and making sure they stay at the centre of the labour and birth process.
I think its timing is perfect. A number of studies have been released since the term breech trial, which has added to the weight of belief that in the circumstances a vaginal breech birth is a perfectly safe option for many women.
Reducing the fear in maternity clinicians will ultimately help to reduce the fear in women, which will improve the outcomes of their labour for them and for their babies.
Certainly I learned a lot about how to counsel women and how to help others to counsel women.
And it's an area which has not been emphasised enough, particularly in the last 14 years when so many caesareans are being done.
If we can achieve a calmer environment for women because their health professionals feel more confident because of knowledge, then we're doing a great service to women and babies of Australia.
The impact and importance of keeping birth physiological, especially for a breech presentation, I hadn't appreciated how important that was before.
All obstetricians, midwives and junior doctors need to be able to facilitate this for women, and even if they're not part of the birth, they need to be able to talk about it in an intelligent, informative and respectful way.
BABE courses are organised by the AMARE Group and held a few times per year in major capital cities. For more information, go to www.amare.org.au or call us on 02 9531 5655.